Buenas tardes a todos y a todas y
Good
bienvenidos.
afternoon, everyone, and welcome to our event, Women Champions in Digital Health. We will be talking about how to make sure that digital health is more inclusive in Latin America and the Caribbean. During this event, we will have simultaneous interpretation, both in Spanish and in English. You can use the interpretation button, which you can see on your screen, to choose the language that you'd like to use.
You can use the interpretation button on your screen to choose the language you would like to use. Mi nombre es Laura Ripani y soy la
My name is Laura Ripani, and I am the chief of the Labor Markets Division at the IDB. It's a pleasure to be with you here today for three reasons. First of all, because we're talking about a fundamental topic, which is that of promoting quality health services for everyone. And secondly, in order to celebrate these digital champions who every single day from different areas of the region do everything they can to improve the efficiency and the use of the health sector and all its resources. And secondly, which is also very much a part of my heart, is to have women included in mathematics and in computer science, because we know that this is very important for labor markets, and it also creates great transformational changes in various social sectors. So here again, this is an invitation to make sure that more women, teenagers, young girls become involved in this area. The digital transformation is essential to promote more efficiency, coverage, and greater inclusion in social services. And this has been extremely important, particularly important, and we've seen this quite clearly as of the crisis, the COVID-19 crisis in the sector of health. Not only do we talk about telemedicine, we talk about how technology can bring these services closer to citizens. The champions in digital health that are with us are the example of all this, and they are indeed an inspiration to make sure that more women are part of these leadership positions and to push forward important agendas supported by the use of technology for the social good. These women have been recognized by the IDB. They've been able to generate important transformations in the health sector. They're part of a minority that many people don't know about, the ones who work in the area of mathematics and informatics. I don't know if you know this, but in the region, only 3 of every 10 workers in mathematics and in computer sciences are women. In order to change this reality and help to change it, at the IDB, we started collecting the stories of inspiring women that are working in order to promote and push forward digital health in this region. Today, we wish to introduce a website that will make them more visible, gives them a voice. It collects their stories. It presents the challenges that these women face and provides recommendations from the 38 champions voice that have been recognized during this campaign. So with this initiative, what we want to celebrate is this hard work and all of the achievements of each and every one of these champions in this field. We wish to inspire more women and girls to come into this area, which is so important. Today, we will meet 4 of the 38 champions that have been celebrated during this initiative. They come from different countries and from the public as well as the private sectors. We will talk to them about what we can do to make sure that digital health becomes more inclusive for women. Make sure that you use the questions and answers button throughout the webinar. This will provide you with a voice as well so that you can be part of the conversation that we will have today. Please write your questions in the space. We will also have some time in order to tackle the questions a little bit later. So we have a very exciting agenda. We're going to start with a local champion, Jennifer Nelson from the IDB, who is a specialist in digital health from the Division of Social Protection and Health. She will give us a brief summary of the work that we're doing in IDB in digital health. And then we will listen to another champion, Mirna Marni, on the principle of an inclusive digital health of the OPS of the PAHO. Then we will also have a panel in order to talk with our champions on digital health, and we will close with a call to action so that all of you could talk about this so that digital health becomes more inclusive in our region. Very well, then, we will start by showing you a short video that summarizes the reason why we're all here today together. 70% of the labor force is occupied, only 25% of the labor force is occupied by women. The salary gap due to gender has to be filled. An equal participation by women in the economy could increase the economy by 160 billion. Women are 60%, have graduated, and they're into tertiary careers and universities, but they only represent 30% of the workforce. And aside from everything else, public visibility of women in positions of leaderships and in those careers are dominated by men, champions in digital health in Latin America and the Caribbean. We are looking for women who are digital leaders. Thank you all. Thank you so much for this space. Now I am going to share my screen. Are you able to see my screen? Asks Jennifer. Beautiful. As I was saying, this is an honor to be with all of you and being able also to open this part of our exchange. In order to start today, I would like to tell you very quickly what we're doing from the IDB group, starting with our 2025 vision, where one of the 5 pillars that we are focusing on is the digital transformation. This is very important due to the dividends that this can bring us, both through the growth in the economy, innovation in our region. But also, specifically from our sector, we have been working hard in making sure that we come up with an integrated strategy to share knowledge and tools to be able to work and to leverage digital technologies to improve efficiencies, quality, and the equity within the sector. As you can see, we also believe that it's very important for our transformation to make sure that all of our neighbors are included and that women can have a very important role in leadership positions during this work. We also believe that digital inclusion goes well beyond gender. It's an important area for all of us, and this is where we should start this conversation. Recently, Lancet published an article that I am going to summarize here. For example, it affirmed that there are huge gaps in this field that are related to women who are the leaders of technological enterprises for digital transformation. There's also a lack of resources for research. So the women just don't have the funds in order to put forward their innovations and their research. And the article also mentioned that globally, we have a lack of being represented in the workforce. For example, in this case, 1 out of every 5 people who work in the technological sector is a woman. And this low representation can take to a low quality in care. I felt the effects of this myself during my pregnancy. I realized that I was outside of normal levels and ranges, and to understand what normal meant, you needed to understand what was normal for a 45-year-old man. As with my example, there are so many other dangers of not having an inclusive healthcare. Here are some of the articles that we'd like to point out. Look at the titles of these articles. I don't know if you knew this, but on average, women are diagnosed 4 years later than men in hundreds of illnesses. And we have higher chances of dying of a heart attack. Sometimes we react poorly to the medication that is prescribed to us. And it has been documented that men doctors discard pain in women. And as you can see in these titles, we have quite a number of challenges from our reality, that is to say, detecting a reality, finding the treatment and an adequate solution, or even worse, not prioritizing the real problems that women have to solve. So there's no real value for us as women. But as you can see, there is an opportunity here. And as you can see, there's quite a bit of research and investment that is devoted to inclusion in this field. An important example is Authentic, which will become a niche sector that will go up to $60 billion globally in the next 5 years. And here, more than ever, with the work that we've been doing at the IDB, as we are working with many countries in the region, we see that many countries are developing or updating their digital strategies. So it's important for us to reflect on the fact that there are certain people around the table or not when we're making these decisions, and how do we make sure that these decisions are inclusive of women. Through the years, I've had the pleasure to meet very inspiring women, but many times from the data to the technical information, we are overcome in terms of numbers and presence. We launched this campaign last year to make sure that women champions in digital health become visible. We have expressed the challenges that we have as women in this field, and we have been thinking about training more and more women in this field because what women are doing is spectacular. We believe that this could be a first step, thinking how it is that we can make sure that digital health in our region is more inclusive. So here are some of the key points when we ask our champions, when we ask them what their challenges are in working in this sector. Many of them said that there's an imbalance in gender presence in the field of digital health. So this is one of the main challenges. There is an imbalance in gender in this field. And sometimes they also say that there are very negative stereotypes that they have to face. Other challenges are institutional. How can we maintain our personal and work lives, and that their shifts allow them to do so? These are some of the challenges that were mentioned by some of the champions. But at the same time, our champions also proposed many areas whereby we can improve and understand what we have to face at this time. The first recommendation that was done, and this is why we are carrying forth this initiative, is the importance to make sure that all this work becomes visible, the work done by these women, of course, so that we can have women working in this field for us, for all the girls that also become inspired in the future. And others had to do with the institutional part to make sure that work shifts are adequate for women. And as we saw with the video that points out some of the loans and those figures, this is related directly to having more women in leadership positions where we can design health systems, considering that most of the workforce is made up by women. As a last point, we also talked about opportunities about women in digital health so that we can keep on sharing and talking about this very interesting topic and to make sure that it's inclusive in the future. You can go to our website in order to read more stories, know about our champions, but I think that now we should listen to them live. And I would like to make sure that I thank all of you, and I'd also like to take advantage of this opportunity for you to listen to you and to go to our website so that you can see the work that we've done. Thank you so much and all the best. Thank you so much, Jennifer. I can see that you have such passion on this topic, and thank you so much for your commitment. I would like to remind you that you can start sending your questions through the questions and answer button. So please take part in this conversation. Now, I would like to give the floor to Mina Marti, who is a specialist in digital health, so that she can talk to us about the 8 principles for digital health, particularly inclusion. Thank you so much, Laura. And thank you to Jennifer, of course. Thank you, Ferdinando and Luis, as you represent the IDB digital health team, with whom we have been working so closely for this to become a reality, including the work with OPS, so that we can look at this development and we can share it amongst all of us. Welcome. Welcome, all of you. Thank you so much for being with us. There's so many people with us, and it's truly a pleasure to be here with you. I would like to tell you that this concept of inclusion requires time, and it's a process for it to be included in the transformational world, in the digital transformation world. See, the PAHO, in a very tight collaboration with the IDB, has been working on a development that started basically in 2016. I will talk about this briefly, but during this journey in 2020, with many of the people that are here today, we worked out 8 principles for the digital transformation in providing medical care. And they're related to the key areas for cooperation in the digital care sector and the United Nations. In a process of voting that we do every year, each country of the Americas region voted unanimously and stated that these are the fundamental points, these 8 principles are the fundamental points to be taken into account so that the roadmaps or the digital agendas of the Americas become inclusive. These are principles that go well beyond the technological realm. And I'd also like to add to what Laura was saying, as well as what Jenny was saying, that it's important to make sure that in education and the training in technological careers, as well as in the health field, there be a conscience and awareness of inclusion, of equity based on everything we develop when we start becoming part of the labor force. These are 8 principles that talk about universal connectivity, an inclusive digital health, interoperability, AI, security in information, a renewed architecture in public health. All of these principles include actions that are related to inclusion, They're all transversal. As I said earlier, if some of them only seem to be technical, that's not so. Because when you think about technical aspects, you should also think about vulnerable populations, minorities, populations that are remote, that have very little access because they're located remotely, and not everything that has to do with having access to this data. This principle that we like so much, Jennifer and I always talk about it, we love it so much, and we talk about this principle, has a very clear message. That is to say that no one should be left behind. It also means that vulnerable populations, both social, cultural, geographically, and all those groups that are not do not have access to information, to computers, and so on, have to be included when this work is done, when the technological work is being done, as well as taking into account the elements of governance as well as social inclusion. So here are some of the points in this call. We have to make sure that we include the gender perspective, equity, solidarity in anything that has to do with a digital health agenda. Sometimes this seems pretty obvious, but if we talk about the practice, when we start working in developing these agendas, these points many times are left aside. And sometimes this is done in an unconscious manner. People are not aware of this, but this is something that has to be present in our minds when we are developing these projects. This is all part of what we have to think of. We have to empower women, children, youngsters, older people, people with disabilities, indigenous peoples. As we did this movement, we were able to achieve all this. So we want to make sure that this inclusion comes from all these communities as well. It's also imperative to analyze credos, religious beliefs, concerns, and motivations, because not all of us share the same ones. And so the problem, the topic of gender, is something that has to be looked at as something that includes other concerns. So these are beliefs. These are beliefs that sometimes we forget when we are developing these policies. These are the points that go through all of these principles. And this is something that we should think of as a matter of fact. And this is what we should be doing habitually, that we should be covering all of the sectors of our population. And this should be part of a strategy and a policy. This already shows us that there has been a change, both in institutions as well as in those that make those decisions. And this is what we celebrate today. This is written, and it's not only a part of my minorities, but of what the majority does. It's become mainstream. So our role in this case is that we have to be sure, we have to be attentive, we have to work together. This is a collective responsibility, as the UN Secretary General stated, so that the digital transformation truly does become a point of improvement in terms of dignity and rights, for that all populations can become more equal. And having said this, now I will give the floor to the true protagonists of this story, the champions. And I do thank you for the participation, and thank you for listening to me. Thank you so much. Mirna, I think your words were excellent. And as you were rightly saying, we have before us an opportunity as well as a responsibility to make the changes in the digital sector so that this becomes more inclusive. But thank you so much for these inspiring principles. How can we achieve all this? We have a panel with 4 of the 38 champions that we are celebrating today. They're champions in digital health that were selected, as we mentioned at the beginning of our conversation, throughout our region. We have 4 of them in order to have a conversation on this. Welcome, all 4 of our champions. It's truly a pleasure to have you here with us. And I'd like to tell you who they are. First, Sonia Maribel Viana from Salvador. She's the coordinator of systems in the health secretary. She's in the health ministry in El Salvador. She works in the ministry and she is part of the coordinating team of Recainza. She is an engineer in computer science with a master's degree in software architecture of the 2021 cohort for the training program for leader women for the Universidad del Bosque. We have Joslyn Carrillas, who's a specialist and consultant in projects of digital transformation, especially in the health field. She is the general manager and member of the board of Recaiza Ho, which is an ONG made up of leaders and volunteers of digital health in Latin America to support strategy and regional strategies for digital health and generate spaces for exchanges and best practice experiences in the private and public sectors. We have Rosa Gonzalez Leon from Paraguay, Vice President of the Paraguayan Health Computer Science. She works for the City Cancer Foundation. She is part of the systematization of information for the Ministry of Health in Paraguay, and she's a consultant in SADI Digital Health. And we have Laura Araya, who has a degree from the University of Santiago, and she also has a master's in medical computer science at the University of Chile with expression in management and of health. She works as a clinical computer scientist in implementing systems of information. She's a co-creator of the blog Innova Matrona, which is Innova Midwives, a space that contributes to the dissemination of the use of these systems in health and clinical computer science. We will start with Sonia, then we will listen to Jocelyn, Rosa, and Laura. I would like to ask you the following question. What does it mean for you to be a champion in digital health? Sonia, could you tell us what you think about this? What does this mean for you? Good afternoon. So what is a champion? What does it mean to be a champion in digital health? A champion in digital health is a woman who has had a career that is able to overcome obstacles. Then I definitely would say that I am a champion, because along my career in digital health, I've been able to achieve many goals. This fills me with satisfaction, but above all, because it has been a rewarding job that has been done with women and men who are full of talent, people that have devoted their efforts and they put their heart in these activities. So I think that this has been fundamental in order to achieve all this. We also have the implementation of our program, which is being implemented throughout our country. We have about 70% coverage at this point, and the government had to decide, well, will we buy, will we purchase, will we adapt, or do we take what we have at home?
We use then what we have, what we made ourselves at home. So that's what we decided. And another important achievement has been our modernization of our hospital in El Salvador by computerizing it. We've been treating COVID-19 patients there. And there was, again, a lot of competition regarding software, but I was told that we needed to computerize the hospital immediately, as soon as possible. So I said, let's start today. Let's digitalize it today. So that is a bit of a trophy, as I see it, that we've won as a team. And there's another trophy that we have if we're talking about inclusion. We had all our family health community teams. They went to the most remote parts of the country. We've brought with us tablets and an app for families to have their medical information there. Social factors of health are also there, and that was a huge challenge, but we did it. And my favorite trophy is our human talent in health, in training young people just out of university or technicians just out of school, and training them that talent and seeing how those young people were making an effort and how now they are leading these digital health teams. So that's another great achievement. That's like a gold trophy for me. Thank you, Sonia. Jocelyn? Thank you very much, Laura.
Ser una campeona en salud digital.
Undoubtedly, being a digital health champion is a huge responsibility and a commitment, individually as well as from a collective perspective. And collectively, because of the work I do at Recainsa, we are committed to continuing to support the efforts of organizations such as the World Health Organization, the Pan American Health Organization, the IDB, and promoting access and universal coverage in health through the digital transformation. And this will allow us to implement national strategies that will have a significant impact on efficiency and on the quality of our health systems. Also, we want to contribute in a very definite way to reducing inequalities that are affecting our countries in Latin America and the Caribbean. And personally, individually, it's a daily challenge, especially when you also have other roles that you need to fulfill. And it's true, in my case, I chose these roles, but in other cases, society has imposed these roles on women, being a mother, a wife, a carer, a professional. And we need to show that the fact that we are women in a world predominantly led by men should not be a limitation. Thank you very much. It's so great to listen to you, and I'll take this opportunity to congratulate all of you. It really motivates us to hear you, and it inspires us to continue. I want to thank you for this recognition. I'm truly honored. I feel privileged to be acknowledged by no less than the Inter-American Development Bank for our work in Latin America. I started when I was 18 in 2001. I was entering this world of digital health, not really knowing all that this would mean in my life. And for me, really, it was a huge challenge. I had to get over fears and my insecurities at the time, and not just because I was a woman, but because I was a woman and a young person. That's another component. If you're a woman and you are young, people look at you and think, no, she will not be able to learn, she will not be able to do it. But young people have so many challenges that they face anyway that they're not afraid. They are thirsty for knowledge. They want to learn everything. So for me, this meant that I had to really overcome those fears and insecurities in my life. I had 5 former boss areas at that point, all of them women, coincidentally, and they were very firm, empowered women, very professional, but they weren't that flexible, we could say. So they were an inspiration for you beyond any perceived harshness or the way that they worked. It was a challenge for me as well to think I have to earn their trust and their confidence. And I was able to do that. I was working in the Social Security institution in my country at the time. It's one of the largest institutions in Paraguay. It has 100 points of access all over the country. And this was a digitalization project for Social Security. It was being part of a project of a very complex hospital system. I was young, I had no experience. So I trained on the job, I learned on the job, I became involved in as many areas as I could from the bottom up. I really started from the bottom. I looked at all the different areas. And I think that's what allowed me to really get to know deeply each one of those areas. People sometimes think they want to go directly up to the top to management positions, but it's really productive and enriching to have the experience of each one of the areas, from reception or being a secretary or technical, providing technical assistance. And then 10 years later, I was put in charge of my section, and those who had been my bosses became part of my team, but we still had a great relationship because finally I decided to adopt the best of what I had seen in them, to adopt their best practices. And why not to make some improvements as well in my management style. So I really had to defeat all those fears. It was a challenge going into the field of digital health in such a complex and large institution. And of course, where most people were men. I had 5 women bosses in different areas, but most of the workers there, of course, were men. So it was a big challenge. As women, we have 2 or 3 times the level of responsibility. We don't just have to do things correctly, we have to do it perfectly. Oh, you think you can do this? Let's see if you can do it well. So it's a triple burden and responsibility for us. And for us women ourselves, when we are a part of a high impact project or a very challenging project, we may not think so, but even other women can look at us askance and maybe not be sure that we're going to make it, and maybe we don't get all the support that we think we should. So this all goes with the territory. I grew in those positions, and 10 years later, I really thank those bosses, those women who were so firm. Some of them wouldn't want to give me an opportunity to do something I wanted to do. I wanted a more challenging project, and they wouldn't give it to me. But in the end, I got there. That's how the process is. So in the end, I do feel like a champion in digital health. And it's the first time I've ever said that. Thanks to that event, thanks to this event, 20 years later, I can finally say, yes, now I feel that I am a champion in digital health, because I have overcome all of those barriers. I have succeeded in all of those challenges, and I was part of a pioneer digital health project in Paraguay, because Social Security in my country really bet on that development and that technological development. And it was an inspiration for other public and private institutions at the time. They said, well, if they could do it, we can do it too. So I think for that reason, I do feel like a champion. And then there were other projects that came later, and these enriched me professionally and personally as well. And we can talk about that later. So thank you very much for this opportunity, and let's hope we'll have more women in digital health. Yes, of course. Thank you, Rosa, for having so much passion and for that beautiful message as well about facing your fears and overcoming them and motivating others to become a part of this field and be women in digital health. Let's go on to Laura now. What does it mean to you, for you to be a woman digital champion in health? Well, it's a surprise. It's an honor, really. It's, I would say, an acknowledgement of my passion, my motivation. And I'm surprised Of course, because I haven't been in this field for that long compared to other panelists, but I see it as a recognition of, again, motivation, passion, and a way to get others to become involved. Through our blog, La Matrona, what we do with another colleague is to incentivize other professionals in health and in other professions as well to become a part of digital health as an area. And that's why this kind of event is so good, because it helps us visualize all this. And I feel very responsible and it's a huge commitment as well. I may be the visible face of this representation, perhaps representing my country, Chile. However, there are so many other women who also work in digital health who may not have access or may not have been seen for whatever reason. And perhaps with the pandemic, the work of each one of these women has become much more visible. But in any case, what this recognition has done is to help me think about all these women I admire and who have motivated me and helped me realize that as a health professional, there is a different road that we can travel. It's a different perspective. It's a path that helps us provide something to our users and where we can be creative and innovative in order to ensure access and opportunities in the area of health. Excellent, Laura. Thank you very much for that response. And yes, truly, we do need a lot of innovation in this field. And I think that is something that you have been providing through this very beautiful project that you lead. We'll go on to the last round of questions. Before we go on to the questions by the participants, we wanted to ask, what are the barriers or obstacles and challenges in working in digital health as a woman? I know you shared some of this as well on the website of the 38 champions. There's a section about this. So we'll start with Sonia. What are some of the obstacles and challenges in your opinion? Well, as women, we also have other responsibilities in the home with our children, taking care of our parents when they're older, when they become ill. So it's a double or triple effort that we need to make. But that passion that characterizes all of us who work in digital health is what makes it so that these obstacles are challenges that we overcome. Another challenge has been seeing that my colleagues or my employees also, my workers also want to be successful in this field. So trying to give them opportunities and incentives and giving them the authorization to be absent when their children need that, because that comes back to the institution through the efforts, the great efforts of these women. And there are other barriers that we set for ourselves. Sometimes as women, we tell ourselves, no, I won't take this next step, or I won't do it because I'm not competent enough, because I still need to get better at this, because I don't fulfill all the requirements or all the expectations, because I don't add up to, I don't have that profile. But we shouldn't be that way. If we have some areas that we need to improve, we should do that. But we need to think that we are good enough. We need to trust in ourselves. Thank you very much, Sonia. Excellent. Jocelyn, we need to be brief with our answers because we also have questions from our audience. So go ahead, please. Thank you. The challenges for us women are numerous, and they're not just present in our sector. There's a gender gap in the digital health field, and it's been shrinking, that's true, but these vertical and horizontal obstacles are still there, and we see them in the smaller number of women that we have in our sector and in other disciplines as well, and in other careers. And the reason for this is that some of these professions have been held by men traditionally, and for us women, it's more difficult to take over leadership positions in various areas of the organizations. And it's incredible that in 2022, we women still have to continue to struggle with gender gaps, but also educational and salary gaps. And this in spite of the fact that we are providing the same services, the same role as men. But Jenny was saying we had 25% lower salaries than they do. So we need to continue to work on this so that we can continue to reduce this gap. Thank you, Jocelyn. Rosa, what would you like to tell us about obstacles and challenges in working in digital health as a woman? Yes, I think there are many of them. And I was listening to my colleagues and they were talking about the other responsibilities we have as women, as mothers, as wives, as daughters who take care of our older parents. But that needs to change a little bit too. There needs to be some equity there too. Just because we are the women doesn't mean that we should be the only ones taking care of our children or our parents. Of course, we will do it. But it needs to be a bit more equitable so that both men and women can have access to the same opportunities and can develop in the best way. If we have a sick child at home and we don't have care for that child, and we can't really work at our best level because we are worried, we are distracted. So we need to have shrink those gaps. And as Jocelyn was saying, we have to shrink them in other areas as well so that we can think and focus on what we can do. And we've shown in projects that we are capable as well. And there might be more demands put on us. Yes, I think that's another one of the barriers. More is demanded of us, 2 or 3 times more. And of course, we will be making mistakes in the projects we make and in activities, but that's normal for men and for women. So I think another barrier I see is a lack of opportunities. We need to work on getting more opportunities for women and more training for women as well, because when training opportunities are announced, for example, and women see that these are careers or areas that are mostly the domain of men, sometimes they don't they don't have the courage to do it. But then we have an event like this one that says campeonas, female women champions. And then you feel, well, that's calling out to me personally. And there are many initiatives in our country in that regard. Fortunately, I'm also a part of an organization of women in technology. It's called Cuñatec. There are others that are part of companies, etc. And they launch training programs and they say coding for women or leadership for women. And I've received some comments from other colleagues and they'll say, well, you women discriminate. Why do you have to say that it's for women? That's not what it's about. It's about telling women, you can do this. You can pursue a technological career. So that's a strategy. And it's not because we're trying to discriminate against men. I want to make that very clear. But we need to be aware that this is what experience is telling us. Women are maybe holding back a bit. No, I don't feel that I can really do this, or we don't believe that we can really do this unless it says this is for women, or we don't have access to this type of training where it's mostly men. So we need to adopt some of those strategies so we can better motivate women and help them get the courage to become a part of all these fields. Excellent, Rosa. Thank you very much. Those were excellent points you made. Now, Laura, would you share your ideas about challenges and obstacles? Can you hear us, Laura? Yes, can you hear me? Yes, well, I agree with the other panelists, and I think that among all these barriers, there's another one that has to do with gender stereotypes and preferences in terms of what we like to study. This is within us, and it's another type of barrier, what kind of careers we choose. So even though there is now a lot of involvement by women in the labor market and in health careers, when we talk about digital health or clinical information systems, we have fewer women there because it's considered more of a masculine field, or we have that idea. And I hope that coming generations will change this. And another thing that happens is that even though there are women working in clinical information systems in our countries, these are work profiles that are not well known or job profiles. So there are challenges in terms of inclusion of women, having opportunities to develop in those areas. In Chile, increasingly, we have these kinds of jobs, but they're not recognized, they're not well known enough. So I think the challenge is in generating a sort of balance in terms of inclusion and gender. Excellent, Laura. Thank you very much for that response. We have a question from Sabrina Morales from Peru. Maybe you can help us answer it. What digital health experiences do you think have had the greatest impact on the population, in particular in terms of sexual and reproductive health? And we are interested in this also because of your membership in this group that you are a member of. So what can you tell us about digital and reproductive health? Thank you very much for the question. I think we've had significant advances in terms of providing support in pregnancy, etc. And there's a lot of literature too in terms of how to deal with this type of issue during the pandemic. I would also like to highlight something that I found very interesting, and that is related to how we have sought a way to take care of the needs of populations that are more vulnerable. And here I'm talking about options such as telemedicine for medical abortions or medical miscarriages. If you look at our midwives group, we were talking about these types of interventions and how they have happened. These are documented. There is literature that establishes that through telemedicine services, we were able to provide this sort of service to vulnerable populations that required this type of service, this type of support, and did not have access to them because of mobility restrictions or because of fear of becoming infected with COVID. So I think this is a very good example, regardless of what opinions we might have about abortion. There's an abortion law, but this is just an example, and it's something that has been fully documented as a measure that was taken and that was able to ensure access to health services in reproductive and sexual health. Excellent. Thank you very much, Laura. There's another question. What are the other elements that make it more possible for women to arrive at this area where there is an intersection of health and digital, and the health and digital field? So what do you think those elements are that can help women arrive at this point where the digital area and the health field come together? Jocelyn. Yes, thank you very much. Regarding the participation of women in this intersection of health and information technologies, we don't have a lot of data. And that's something that we who have been acknowledged as champions need to be involved in. We need to document all this information. And it's important to mention that digital health arose because there was a need for it from all of us, a need to transform the sector and to involve even many other areas, bring them together because health is for everyone. And I'd like to link this question to another one that I saw that mentions the idea of how we can bring in new professionals as well who perhaps have not been trained in STEM careers. But digital health requires people from many different disciplines, many different sectors. And here I want to share my own experience. I did not study a STEM career. I did not study for a STEM career, but it's thanks to volunteer work that I did at Recainza that I decided to start to work in the field of digital health because I saw the need that existed in our communities. And I saw the need to start providing solutions that are more equitable and that take into account the needs of all the communities, in particular of the most vulnerable ones. So we need everyone. We need economists, statisticians, administrators, managers. Obviously, we need professionals, health professionals from various fields within that area and from various areas within the field of that digital technology so that we can come up with more equitable and inclusive digital health solutions. Thank you, Joslyn. That was excellent. We are almost out of time. We've been sharing the questions from the audience. We do thank all of you for being with us. And we want to thank our 4 champions as well, representing those 38 digital health champions, all very worthy, having received this recognition, and all the women who work hard every day to make sure that more people, more women have access to health services. And we are working together to build a healthier and better world. So the hashtag is Juntas Somos Más. Together we are more, together we can do more. And this is a very enriching network for the whole region. So spread the word, share the URL of the website, tag other women who may want to work in this field. I'd like to give the floor now to Ferdinando Regalia. He is the manager of the social sector of the IDB. Ferdinando Regalia, manager of the social sector at the IDB, for some closing words. Thank you very much. I've never felt so happy being a minority. Thank you to Laura, Jenny for organizing this, for our champions. Thank you also, Joslyn, Laura, Rosa. Thank you very much. Your testimony is really so rich in lessons and information for us. And I'd like to thank all the women who, as Laura said, really work every day to make sure health services are accessible to more people. So I'll just echo what Laura said, spread the word, tag other women, write your own histories, and let's all work together to build a healthier and better world. Thanks once again to our audience, and congratulations to all of you.